My name is Sandra Taylor. I'm the lead Ophthalmic Research Nurse Manager in St Paul's. That's an eye unit that works within the hospital, and we have our own research centre. My job is to manage that research centre. The main research I'm involved in is to do with macular degeneration and people with poor vision. So we look at patients who have macular diseases, medical retina eye conditions. We also look at ocular oncology, glaucoma, so everything to do with the eye and vision. My relationship with patients is very important. What happens with patients who come with visual impairment? They have some difficulties when they try to read information leaflets, so we often read the information leaflets to patients who are on clinical trials. So one of the reasons I stay within research is because I clinically want to work with patients and encourage them as far as possible to be aware of clinical trials, what involvement they may have, what they need to know, and what information will help them make a decision as to whether or not clinical trials are right for them. I think a patient joining a clinical trial, one of the most important things for them to be aware of is whether or not the trial is successful. It's the fact that they feel that they've done everything they can to make a difference to whatever condition they have. So I think it's important that they explore every avenue that's open to them, and that way, regardless of whether the trial is positive or not, they feel that they have done something that may help them, or even if it can't help them, maybe some other people in the future. The quality of life of patients taking part in research trials mainly is around how it affects them, how they feel their participation makes a difference not only to themselves but maybe to the wider population. I think it's also important that they feel they've explored every avenue in their care and their eye conditions, and that way I think they feel and know that they've done everything they can to make a difference to themselves, and they don't feel disappointed that they haven't explored something. The National Institute for Health Research is a combination of partnership really, working within St Paul's and the Eye Research Centre. We work closely with the National Institute for Health Research, and if we needed some help, say to have patients collected for clinical trials, they can help us with staff if we've got short of staff or somebody's gone on maternity leave, all these kind of things. They also help us to look for partners to work with research companies, and we were actually part of an award-winning team for the National Institute for Health Research, and we were the team winners for 2018, which was a great thing actually. After working in research for 20 years, it was fabulous to win that award. I think clinical research, particularly for ophthalmology, what we would like to see is how we can reduce visual impairment and blindness in the population. I think that's the main important thing. It's around maintaining people's independence, maintaining their ability to read, and just to live their lives with better vision. So for us, it's around having clinical trials that will allow possibly, who knows, transplant of eyes. We've got transplant of stem cells that's making a big difference, but it's the next level, and that's the holy grail really of research, isn't it? Is to eradicate the eye conditions in the first place.